Welcome, welcome. As people are still joining, I just wanted to welcome you all and thank you all for joining our Inclusive Education and Early Childhood Community of Practice meeting today. You'll see on the slide, we have 6 presenters today who will be speaking about the incredible work that they're all doing. And thank you all to our speakers. We're very thankful for you joining us today across many time zones. So thank you, thank you, thank you. And if we go to the next slide, Katie. I just wanted to provide a quick update before we start. We've talked about this throughout the community of practice in the last few months, but together GCE, IDA, and IDDC co-created an inclusive education call to action back in September off of the Transforming Education Summit. And we have been working really hard to advocate for these 3 key areas for inclusive education. And we really want you to take a look at it if you haven't and consider endorsing it. We are almost at 200 endorsements. And so we really encourage you to take a look. You can view it looking at this QR code, or I will put the information on how to look at the call to action and sign it. Next slide. You can also use these QR codes. We have 4 different versions: English, Spanish, French, and Arabic. And I'll put the information on how to sign the call to action into the chat and then also send it after the meeting. Please feel free to introduce yourself into the chat. Let us know where you are joining from. We will be sending out all of the additional materials, including the PowerPoints, any links that are shared throughout the presentations today, and notes from the meeting notes. So with that said, I'd like to welcome our first presenter. Maha, are you able to come in? Maha Khochen. We are excited to have you joining us today. Maha is with ECW, and she's the Disability and Education Specialist, and she's going to be talking to us about an update from the High Level Financing Conference. And thank you again to ECW for signing the Disability Inclusive Education Call to Action as well. We are very, very thankful for that and excited to hear about the incredible work that you are all doing and helping to prioritize children with disabilities. Over to you, Maha.
Okay, yeah, thank you, Stephanie, and thank you everyone for inviting me to present today. Yeah, as Stephanie has mentioned, I specialize in equity and inclusion in education, and I have joined the education team at Education Cannot Wait late last year. So for today, I will be giving an overview about our commitment to disability inclusive education, and will be giving an overview also about the conference, like Stephanie suggested in the introduction. Yeah, we'll just have my presentation ready. So the outline of my presentation, which is the next slide, yeah, this is what I will be covering based on the suggestions I was given. Next slide about the disability accountability framework. So at the Education Cannot Wait, we have the disability accountability framework, the accountability framework on disability that was developed through following a participatory approach with and for persons with disabilities and their organizations in 2021. This policy and accountability framework is our blueprint that we follow to advance disability and inclusion. It has 3 objectives. The first of these focus on the organization and on our day-to-day work in terms of making them aligned with equity and inclusion, and the way the organization operates. The second relates to sorry. The second of these is related.
Is it important? Let me ask. Is it important? You know, sometimes if we have so many people, what do you think it will?
Sorry, 1 second, Maha. We just need to, is it possible to unmute yourself? We muted everyone for the time. Let me do Maha. Okay. Apologies. If we can all just be sure to stay on mute during the presentations, that would be great. And Maha, you've been, I'm not able to unmute you. Are you able to unmute yourself? There we go. Great. Go ahead, Maha.
So we are now on slide 3, which is the policy and accountability framework on disability. So I was explaining that this is the blueprint that we follow in order for us to ensure that the organization in the way it operates follows and advances disability inclusion, and also in the programs to ensure that disability and inclusion is systematically applied and advanced, and also to ensure that through our partners, disability inclusion is also advanced in education and humanitarian context. The next slide is related to the strategy plan 2023-2026 that the ECW has, and in this strategic plan, equity or quality inclusive education is also central to it. It focuses on 2 main objectives. The first of them is to increase funding to education and emergency and protracted crisis, and the second of these is to advance capacities and systems in context of education and emergencies and protracted crisis. We do this through different ways, including advancing gender, disability, and also taking a whole approach to inclusion and advancing the work with local context in terms of localization of our work in the context where we do work. Now, the following slide is about our commitment through the Transforming Education Summit call to action, which we have recently signed in February 2023, and by signing it, like Stephanie has mentioned, we have joined the nearly 200 organizations that have signed this call, and signatory bodies are committed through this call to have funding allocated to advance disability inclusion, and also to have plans, mid and short-term plans to reach all persons with disabilities, and also to have interventions that mainstream disability and others that are focused on meeting the needs of persons with disabilities. Now, the next slide is related to Education Cannot Wait ECW requirements. We require from our grantees and applicants that their programs must follow a twin track approach, and by that we mean that the programs must have interventions that mainstream disabilities by applying universal designs, and also to ensure that the particular requirements of persons with disabilities in the context that they cover is also met. For example, provision of technology, for example, provision of independent learning skills. So it depends on the context where they operate, but they also need to ensure that the specific needs related to advancing the inclusion of persons with disabilities is also met. We also require from grantees and applicants to aim to reach 10% of persons with disabilities, and also to consider the intersectionality between age, gender, disability, and the status in the country, and so on and so forth. Slide 8, situational analysis. For us to reach 10%, we very much ask our partners and applicants, of course, to explore the barriers that face persons with disabilities in the context where their program cover, to look at the barriers and also to look at possible enablers, and on that to build their interventions. We very much look at the interventions that are localized, which means meet the local the requirements of the local beneficiaries. The next slide, we also recommend and suggest that our partners and the grantees do engage with organizations of persons with disabilities and persons with disabilities themselves throughout the different stages of the implementation of their programs. We very much recommend that persons with disabilities and their organizations are partners, implementers, and contribute to the whole project. The next slide. We also do recommend that by reaching persons with disabilities, also our partners and applicants, they also need to consider that disability is diverse. There are people who have visible and invisible disabilities. Some of them have mild, some of them have severe, moderate, temporary, permanent. Some of them have their disabilities acquired at a later stage, some of them at birth. So there's diversity, and also in their intervention to recognize that people with disabilities are diverse, even if they share the same type of disability and severity of disability as well. Next slide. Also, we very much encourage the use of Washington group sets of questions, and to establish accessible feedback system to ensure that data or feedback is gathered through different ways from different beneficiaries, including children, their caregivers, and teachers. So this is the next slide, sorry. The interagency standing committee guidance on disability inclusion in a humanitarian context. These are the guidance that we very much also advise to use in our funded programs, mainly in relation to how organizations for persons with disabilities can be engaged throughout the different stages of the program. So that's in terms of our commitment to disability inclusion. That's in brief what the overview that I wanted to give you. Of course, more than happy to answer any question if I can at the end, if you would have. But for the second part of my presentation, I would like to give an overview about the conference as colleagues have suggested I do. So we'll move to the next slide. So last month in Geneva, we held the high-level financing conference, which was hosted, co-hosted by ECW and the government of Switzerland, and it was co-convened by Colombia, Niger, South Sudan, and Germany. It was over 2 days, and the conference aimed at mobilizing resources and pledging or aiming to fund for our strategy plan. So the conference was attended by nearly 700 people and in person, and over 2,000 people online. And the conference order was pledges made by government, non-government, and private sector that reached nearly slightly less than $900 million. So that all will help in fulfilling our commitments as outlined in the strategy plan 2023-2026. So we'll move to the next slide. Now, in terms of disability inclusion in the conference, we know from previous conferences, sometimes when the conference is not focused on disability, we know that disability would be the focus of a session or two. In this conference, disability was mainstreamed throughout the conference, from the opening session right to the final session. Issues related to disability were discussed, raised, and talked about in nearly all sessions. There was presence for persons with disabilities, for their organizations across the whole conference. And also there was the side event on disability inclusive education, in addition to mainstreaming disability across the whole of the conference. In terms of accessibility, we tried to make the conference as inclusive as possible. We tried to inquire about the needs of participants and try to meet them. We had sign language interpretation, we had captioning, and also we had translation to different languages. We also had assistant for those who required it was available. Now, I'm saying that, and I'm very also aware that there are a lot of room for improvement, and we will be collecting feedback very soon from participants in order for us to build on the experience that we had through the high-level financing conference for future events. So that's in terms of our commitment and in terms of the high-level financing conference that was held last year. I'm happy to answer any question that you may have at the end, but for now, I thank you so much for your attention.
Thank you so much, Maha, for presenting. That was really incredible. We were really excited to see, all of the work and dedication and commitments that ECW is making to disability inclusive education. On a similar note, we're going to hold off for questions for Maha until after the next presentation because they are very linked. We're really excited to hear more about the work that IDA is doing with ECW. And so next, our presenter is Amba Salelkar. She's the Senior Technical Advisor for the International Disability Alliance. So over to you, Amba.
Thank you very much. And it is my pleasure and privilege to present our recent project along with supported by ECW on accelerating quality, inclusive, equitable education in emergency for girls and boys with disabilities through partnerships with OPDs, including pilot interventions in the countries of Niger and Colombia. This is a project that is being led by the International Disability Alliance, along with one of our members, Inclusion International. Before I begin with the presentation, you can move to the next slide, please. I will tell you a little bit about the International Disability Alliance. So we are an alliance of organizations of persons with disabilities. We have offices in New York and Geneva, but we have staff around the world. I am normally based in Chennai, India, but I come to you today from Geneva. Our members are global members as well as regional members. And on this particular project, we are very happy to be working with, like I mentioned, Inclusion International, but also our regional members, the African Disability Forum, who I believe Abebaw will be speaking to you later today about their work, as well as as RIADIS, which is the Latin American Organization of Persons with Disabilities, and their families. Our 8 global members and 6 regional members have their own members at the country level, and we have therefore a network of over 1,000 organizations of persons with disabilities across the world. On this particular project, we will be working with members of our regional members. In Colombia, it's Us Down Colombia, which is a member of Inclusion International. And in Niger, it is the Federation of Persons with Disabilities, which is a member of the African Disability Forum. And these are the 2 focus countries for the work. IDA has been working for a very long time on the issue of inclusive education. We have been involved, of course, right from negotiations around the CRPD to further jurisprudence of the Committee on the Rights of Persons with Disabilities, including in advocacy towards the general comment on Article 24, which relates to inclusive education. IDA has also authored a number of reports around inclusive education, as well as contributed to other stakeholder reports. And we were very happy that we could also support a team of OPD representatives, particularly youth, to participate in events, for example, the ECW conference that Maha just told us about. Coming back to the project, the next slide, please. The overall aim of the project is to enhance opportunities for girls and boys with disabilities, including those from underrepresented groups, to access inclusive education in situations of emergency and protracted crisis through inclusive interventions which are co-developed with OPDs. IDA has also been involved in a lot of the work which currently frames the tools that are available around inclusive humanitarian action. Maha also mentioned the IASC guidelines on inclusion of persons with disabilities in humanitarian action, which was something that IDA supported by organizing consultations at various regional and country levels towards the building of those guidelines. And we are also right now engaged in other projects with other partners, including UN agencies, on implementation of these IASC guidelines and other tools. So this project has been a great opportunity for us to bring our work on inclusive education and on inclusive humanitarian action together. The next slide, please. For us, the project has certain key results. Our results include strengthening of systems, so building capacities of both organizations of persons with disabilities, OPDs, and humanitarian actors, creating a shared frame of reference for inclusive education in emergencies, improving collaborations between OPDs and humanitarian actors, and documenting partnerships in order to scale up. Because from our work, we've seen that a lot of people want to do the right thing, but it's a question of how. So capturing these is a very important result that we are expecting from this project. We would also like to develop OPD-led global knowledge products to enable removal of barriers to access. And we also want to equip families with an understanding of the right to inclusive education in emergency situation. And on both of these aspects, we value the leadership of Inclusion International, because Inclusion International has been one of the most important organizations in really talking about what inclusive education really means for all children with the disabilities, and working with family members as well. We also hope to equip teachers and schools with the knowledge on how to deliver inclusive education in crisis situations. My next few slides are on the expected outcomes and activities, which I will just go through in brief. One of the outcomes that we have is around enhancing capacities. And in this, we would be looking at data on barriers to inclusive education in emergency contexts. We envision capacity building workshops for OPDs led by OPDs. And for this, we rely on our extended community of practice. We are also looking at workshops for family members, bringing OPDs and humanitarians together, and also looking at how we work on OPD inputs into the multi-year program processes in both the countries of Colombia and Niger. Our next outcome is looking at inclusive pilot interventions, looking at active collaborations with OPDs leading to safe education in emergency interventions. And for this, we hope to support, again, OPD-led training workshops on how to deliver inclusion in classrooms, and also equipping delivery actors on education in emergencies on OPD-developed resources. The third outcome is evidence generation and sharing. And of course, this is something which we in the disability sector value both as a tool for OPDs, but also for influencing other actors. And here the learning from the two country pilots, which are in two very different contexts, is important to be documented and shared with global actors, humanitarian actors, actors on education and emergencies, in order to deliver and disseminate the knowledge products to humanitarian actors beyond these two countries. For us at the International Disability Alliance, we have a very strong commitment to intersectionality in all of our work and our capacity building activities. In our production of inclusive technical responses, we highlight the participation of underrepresented groups of persons with disabilities, as well as on gender. So this project as well, we include a gender lens in capacity building modules. And we would also like to look at the gendered barriers, because as Maha presented, persons with disabilities are not homogeneous, and gender is as much a determinant in the experience as other factors as well. We will not, in this project, be directly working with girls and boys with disabilities, but we will be looking at protection issues and hoping that we can mainstream this through project activities. So we look forward entirely to this, to the kind of evidence building that this project would lead to the outcomes, and of course, through our members at the regional level and the global level, we hope that we can leverage these in order to influence many, many more actors in different regions. So that brings me to the end of my presentation, but I am very happy to take questions. I just want to flag that this is a project which is just launched, so a lot of it is in process. So, but anything that I can respond to, particularly on IDA, I would be very happy to respond. Thank you very much.
Thank you very much, Amba and Maha, and to everybody that's doing this fantastic work and collaboration. We're not yet seeing indication of questions in the chat box, so we'll continue the conversation. One of the things that I think would be especially helpful, thank you, one just came through, is, two quick questions. Thanks to Umar, what informed the choice of the two countries that was described for this initiative, and how can organizations get involved and contribute? Like you said so well, Amba, there's so much opportunity and need here, and so we'd love to learn more about how we can all be supportive and help to expand this work and get involved. Thank you.
Okay, I see a lot of questions about the two focal countries. So let me come back to our decision-making at the International Disability Alliance. So like I said, we are the secretariat, but we have a board of organizations. And I'm going to put my video off because my internet connection is a little unstable. But for us to say that we have developed this in collaboration between our organizations. So for us, while all of our members work, they have their own scope of work, and for sure, there's been a lot of exciting developments on their own end. What we also have is that we have our members working together is something that we also encourage that kind of cross-regional exchange, bringing the global expertise that some of our members have to the regional levels. And so this was developed in consultation with our regional members, RIADIS in Latin America, and the African Disability Forum in Africa. And of course, as Maha mentioned, like when you look at when we were proposing, when we developed this proposal, it was important that we propose contexts in which education in emergencies is relevant and is something that we had a strong presence of our network in those countries in order to deliver on the outcomes, which you see are quite ambitious. So for that, for us, this was a consultative process that was developed, and these two countries were chosen. We're not saying, of course, that this is not a relevant issue in other contexts, but we prefer to develop or our tools, etc., to pilot it in these two countries. We have a strong membership. We also have a strong presence of our community of practice. So we have alumni from our various training initiatives who are on the ground and who are able to sort of engage in these capacity building initiatives, etc. So that's pretty much the story of how these countries were selected.
Great. Thank you both for such presentations. If there are any more questions, we would really encourage participants to utilize the chat, and we'll continue to get to those questions throughout the rest of the meeting. At this time, I'd like to thank you again both for presenting. We're going to transition to our next presentation, which will be, thank you, Zubaida Onono, the Program Officer on Education at Development Research and the Project Center, to talk about their inclusive education and early childhood programming. Over to you. Zubaida, are you able to come in?
Can you hear me?
Yes, there you go. Thank you.
Oh, thank you. Thank you, Stephanie, for the introduction, and good day to you all. We're pleased to share our work on inclusive ECCD programming with specific focus on policy and practice of play-based learning in ECCD in Nigeria. I'll be speaking briefly about the dRPC, our previous work in the ECCD space, and the most recent national dialogue on play-based learning in Nigeria. Next slide, please. So the dRPC Development Research and Project Center is a non-governmental and non-political organization formed by 10 former lecturers of Nigerian universities in 1993. The dRPC is an intermediary social enterprise committed to building capacity and social capital for inclusive development. Our approach is to implement programs to strengthen the capacity of CSOs, who in turn will deliver quality services to marginalized groups, especially women and children, and also for the CSOs to advocate for
Looks like we're having a little bit of a technical delay.
Hello.
Oh, there we go. You're back. Thank you.
Yes, so sorry. My network is a bit unstable, so I think I'll put off my video to enable better connectivity.
Great. Thank you.
Yeah. So I was just saying that our approach is to implement programs by strengthening the capacity of CSOs to deliver quality services to marginalized groups, especially women and children, and also for these civil society organizations to advocate for improved accountability and services from duty bearers at all levels. Our area of work at the dRPC are education, health, and sustainable livelihood. Next slide, please. Yes, so, hello? Okay, great. So I'll be giving you a brief highlight on our work in the ECCD space in Nigeria with regards to our past projects. So the dRPC has been working in the field of ECCD with funding from Bernard Van Der Foundation since 1999. And in 2019, the dRPC implemented the second phase of the Partnership to Strengthen Innovation and Practice in Secondary Education (SIPSI) project with funding from MacArthur Foundation. Through this project, 40 female secondary school leavers were trained and supported to establish community-based ECCD centers in collaboration with state ministries of education and relevant education boards. This turned out to be a huge success as the intervention met the needs of the average out-of-school ECCD-aged child in these communities, thereby benefiting over 1,500 children in Kano and Jigawa states. Here are photos of the ECCD centers at the inception stage. Next slide, please. So the dRPC, working in the area of research on ECCD, have come to realize through our experience and the works we do that most ECCD classes and even private classes place a low value on play, and there is no much difference between primary 1 and the ECCD class in terms of teaching techniques. Based on these findings, we were able to pick out 5 key factors to explain why play is given low priority in the ECCD space. In no particular order, we realized that teachers and caregivers of ECCD and nursery school prioritize education components and give little time or attention to play. We also found out that there was inadequacy of space and also poor funding or no funding to purchase play items in these ECCD settings, especially in the non-formal education settings, such as the displaced people's camps. With regards to parents, we realized that parents and guardians believe that the major indicator for their child's learning ability is the child's ability to recite state and capitals or the English alphabets between the ages of 4 and 5, rather than the child's ability to draw, sing, or do some creative activities. We have also heard from teachers that the national ECCD curriculum and teachers' manuals do not give sufficient guidance for in-service teachers on how to deliver child-centered and play-based learning teaching methods. Unfortunately, this is also the case for pre-service training curriculum. Also, the absence of instructional ECCD materials in the mother tongue has emerged as a new challenge following the new national language policy, which makes the pupil's first language the compulsory medium of instruction. Next slide, please. So these findings have inspired us at the dRPC to work in collaboration with the Nigerian Educational Research and Development Council, NERDC, with support from Ford Foundation, to bring key stakeholders in ECCD space, including government, ministries, departments and agencies, MDAs, academics and experts, to discuss the challenges and obstacles, and also to make recommendations for increased implementation of place-based learning in ECCD in Nigeria. This one-day national dialogue was held on the 15th of February 2023 in Abuja, and the aim was basically for us to find out ways or to get recommendations for implementing increased implementation of play-based learning in ECCD. Next slide, please. The dialogue took the form of panel discussions. We had 3 major panel discussions where we discussed about the challenges of incorporating play into public, private, formal, and non-formal ECCD education, and strategies for addressing the challenges. Also, in the second panel, we discussed about designing of safe play spaces to meet the needs of children, including children with disabilities and children in non-formal settings such as hospital and displacement camps. And in the third panel, we went on to discuss about the pre-service teacher training and in-service teacher development to strengthen teacher capacity for facilitating play-based learning in Nigeria. A lot of rich recommendations, challenges were pulled out of these conversations. But briefly, we want to highlight the key challenges, which were the lack of qualified teachers, inadequate infrastructure, lack of teaching resources and learning materials, poor supervision and mentoring of the teachers, overcrowded ECCD centers and schools, insufficient security for ECCD centers, strict parenting, and also the Nigerian Integrated Early Childhood Development Policy was dated or is dated 2007, and we believe that this is due for a review and in order to address the emerging challenges in the ECCD space. Next slide, please. So just to bring out the key highlights and outcomes from the second panel on designing of play spaces between the needs of children, including children with disabilities, and in non-formal settings such as the hospitals and displacement camps. There is a link right here where you can access a video of how the panel went. The dRPC sought to understand the position of the government and what the government is doing with regards to the inclusive education of ECCD. And then we went ahead to conduct a budget analysis. A fact sheet of our findings will be shared at the end of this meeting, or perhaps in the comment section. We realized that the Nigerian government is indeed moving towards inclusive education in ECCD. We identified 3 budget line items which had budgetary provisions for ECCD in Nigeria, and 2 out of the 3 was focused on retooling of special needs teacher and integrated early childhood development, while the second was a training component on special education needs and disabilities and awareness creation and ECCD intervention. Another outcome was that the experts, through dialogue and critically looking at the situation, make recommendations to widening the scope in which ECE, that's early childhood education, is offered to children. There was a fact that we found by the UNICEF, where it says 95% of children with disabilities do not have access to education in developing countries. So if these children do not have access to education and may most likely never have access to education in their lifetime, where are they? So we're now thinking to explore other sectors to provide early childhood education to children. We also realized that playgrounds in ECD schools should give consideration to play items for children with special needs. Teachers advised to explore the use of culturally relevant settings for teaching ECCD level. And also the establishment of play areas to satisfy children's needs requires experienced and well-trained ECCD teachers. And for sustainability of these play spaces, we realize that the key issue in practicing play-based learning is the lack of play items. Hence, the teachers are urged to use local and readily accessible materials to create play items, including creative toys from the use of waste materials. Next slide, please. Can we have the next step? Thank you. So in conclusion, we realized that the first and paramount thing to do is for the integrated early childhood development policy, the minimum standards for ECCD in Nigeria, and also the corresponding teacher's guide to be reviewed in order to address these emerging issues in ECCD. We also recommend that there is a need for awareness creation and advocacy on play-based learning in ECCD in Nigeria. Finally, it is necessary to conduct capacity building for ECCD teachers and incorporating content to meet the needs of children with special needs. And with our takeaways from this national dialogue, the dRPC, with support from Ford Foundation, is working with the Federal Ministry of Education and the Nigerian Education Resource and Development Center, NERDC, also with UNICEF, to review the integrated early childhood development policy in Nigeria, the minimum standards for ECCD developed by the NERDC, and also all relevant teachers' guide. Next slide, please. So with this, I come to the end of my presentation. I thank you for listening in all Nigerian languages captured on the screen, and I look forward to answering your questions. Thank you.
Thank you so much. One question that we have just to kick off the discussion, thanks to Mark for sharing it. How does dRPC convince parents that early play activities are better for children in ECD programs, for example, versus teaching facts in a non-play-based way? So I know this is something that many of us grapple with around the world, and so we'd love to hear any brief reflections and promising practices you might share on early play activities and inclusive early play. Thank you.
Thank you for that question. This is one of the key questions that came up at the National Dialogue. We realize that most parents do not really understand what ECCD is about. The approach that was recommended by experts and also the government officials in the room was to ensure that there is intensive awareness creation, not only for teachers, not only for the relevant NDAs and stakeholders, but also for parents to understand the value of play, so to engage in supporting the educational system in engaging children at the ECCD level in play, creative play, in which they can learn through. So this is the major recommendation we got from the National Dialogue on how to carry parents along. Awareness creation. Thank you.
Terrific. Thank you so much. And let's continue in the chat box to share ideas. And I'll pass to my colleague Stephanie Pena to introduce our next presenter. Thank you very much to Zubaida and to everybody at dRPC.
Thank you, Jennifer. Yes, great presentation. It's really exciting to hear all of the fascinating work that you are all doing. I'm going to now introduce our next presenter, Abebaw Abebe. who is the Senior Program Manager at African Disability Forum, who will be discussing a bit about their Inclusive Education Manifesto. So over to you.
Yes, thank you, Stefani, for that great introduction. Hello, everyone. My name is Abebaw. I'm speaking right from Addis Ababa, Ethiopia. Glad to be here to share our experience on inclusive education. So before I dive into my session, let me say a few words about my organization, the African Disability Forum. So ADF is a continental membership organization of organizations of persons with disabilities in Africa, headquartered in Ethiopia and registered by the Ministry of Foreign Affairs of Ethiopia. Next slide, please. So our vision is to see an inclusive Africa where all persons with disabilities and families enjoy their rights as outlined in the United Nations Convention on the Rights of Persons with Disabilities. So our mission to achieve this is promoting the rights of and inclusion of persons with disabilities and their families in the continent through various mechanisms such as empowerment, participation, unifying and amplifying their voices, and strengthening their organizational capacity. We do have offices in 3 countries now: Ethiopia, South Africa, and Niger, and a number of member organizations from 45 African countries. Like, for example, in Kenya, we have a member organization called UDPK. In Uganda, we have NUDIPU, just to mention some examples. And also 4 sub-regional organizations, such as WAFOD, West African Federation of the Disabled, among others, and 9 continental OPDs, such as African Union of the Deaf. We are also one of the member organizations of the International Disability Alliance. So in October last year, next slide, please, we organized a regional conference on inclusive education. So this was held in Ethiopia, where we invited about 25 people, invited from various countries. And this conference was part of the project we have been running called Helagia Project. So the participants came from Ethiopia, Rwanda, Benin, Madagascar, Mozambique, Gambia, and Botswana. As these are the countries where the project has been running. So this regional conference gave birth to a manifesto on inclusive education. So this manifesto, next slide, basically has 4 elements about inclusive education, which are witnesses, concerns, commitments, and call for action. Next slide. So the participants at the end of the workshop came up with this manifesto, and the first point was about their witness regarding inclusive education. So OPDs at various levels, at local, regional, and national level, have been doing good advocacy work for promoting inclusive education in Africa, yet they have not been sufficiently consulted and meaningfully participated. So this was one of the witnesses of the manifesto. Next slide. The second point was various stakeholders, including governments and partners. They have been doing a great job on inclusive education to have, educated human resources and to improve the education system in the continent, ensuring everyone has the right to education, including learners with disabilities. And they also witnessed that education is a powerful tool for individual and national development, as every child has the right to education. Next slide. The other witness was about barriers. So barriers to education exist within and outside the education system in the continent. So these barriers include such as inaccessible infrastructure, lack of teachers training and support, and etc. Next slide. So the second point was concerns. So they mentioned 5 pointers as their concerns regarding inclusive education. One is limited access to inclusive education materials and accessible learning environment and pedagogy to learners with disabilities. Because there is a need for more learners with disabilities to meet the needs of learners with disabilities and ensure inclusive and accessible learning materials. Next slide. Lack of up-to-date and reliable disaggregated data has been also mentioned as one of their concerns, because disability disaggregated data is very important for evidence-based decision-making. Next slide. The third concern was exclusion of learners with disabilities in emergency settings, because in emergency situations, children with disabilities will not have adequate access to education, just like their counterparts in safe settings. So millions of children with disabilities are in need to have access to inclusive education. Next slide. Limited implementation of the United Nations Convention on the Rights of Persons with Disabilities, specifically Article 24, which talks about inclusive education, is also one of the concerns that's part of this manifesto. Next slide. Poor training, motivational incentives, and support provided to teachers, school community, education officers are also one of the concerns as mentioned during the conference. Next slide. So they mentioned 4 major commitments that's part of this manifesto. One is to support the government and decision makers, the African Union, even the African Continental Umbrella OPD, ADF, other non-governmental organizations, UN agencies, to help them in developing and implementing inclusive education frameworks and strategies, and by sharing, their lived experiences. Next slide. They also mentioned their commitment to support and collaborate with duty bearers on their commitment to be compliant to the CRPD and the Rights of the Child, CRC, and also the African Disability Protocol. Next slide. And also they are committed to play a significant role and work together with OPDs as one and combined entity with joint voices and with other stakeholders involved in implementing inclusive education at various levels, from local to global level. Next slide. They are also committed to carry on public awareness strategies and interventions to change the negative attitude and perceptions regarding learners with disabilities in accessing education, like to change the attitude of the community and to promote sending learners with disabilities to school. Next slide. So the fourth was a call on action. So they called the UN bodies, agencies, to provide support to states to collect disability disaggregated data at schools, community, at national and various levels. Next slide. They also call on governments to, ratify or implement inclusive education policies to ensure access to education to all, including learners with disabilities. Next slide. They also call on governments and international cooperation donors to increase their financial investment in inclusive education. And also they call on states parties and education stakeholders in the continent to strengthen their commitment in removing barriers that are hindering learners with disabilities from accessing inclusive education. Next slide. And finally, they also call on all stakeholders of the education sector to ensure meaningful participation of persons with disabilities and their organizations to, comply with nothing about us without us motto of the disability movement. Yes, thank you so much for your attention. If you have any questions, you are very much welcome.
Thank you. This is terrific. A few questions, and thanks to everybody for participating. And we're grateful to all of you for sharing your reflections and ideas. And in particular, if all presenters would be able to continue to share ideas and answers, we're going to share just a few of the questions that are coming in the chat box now. So first, what are the mitigation strategies employed by stakeholders to ameliorate challenges? And, especially as OPDs. There's also a question regarding the empirical research work conducted with different types of play to foster resilient skills and holistic development in children. Is there any empirical work that has been conducted in the area of inclusive play to foster resilient skills of children? And in the regional meeting now and over the years, what clear efforts have been made to ensure that millions of children with disabilities have access to education as EFA, Education for All, is concerned, bearing in mind the limited equipment that might not be available in most African countries currently to make schools inclusive. And then also a question, thanks to Kamal for all presenters, what are the inclusive education indicators that you work to achieve and by when? And one quick earlier question as well, and reflection on looking for ideas on can there be more resource mobilization especially for hard to reach communities, and does your government support the assessment costs of children that exhibit some disability? So we realize that is a lot, but just wanted to take a moment here if you'd like to answer in relation to this this manifesto and the work, this important work coming out of your recent conference. And then we'll encourage people to continue to use the chat box as well to share ideas and resources. Thank you so much.
Yes, so Those questions seem a bit difficult to answer, but let me try. Maybe regarding study on the status of children with disabilities, as indicated in the manifesto, timely data, reliable data should be available. For this, studies should be conducted to know the exact status of children with disabilities. I know there was a recent study done by the African Union on the status of children with disabilities in general, not specifically on inclusive education, but I think we need to have a specific study on the status of learners with disabilities regarding access to education.
Thank you so much. Absolutely. And we encourage all presenters and participants to continue to share ideas in the chat box. Thank you very, very much. We've shared the manifesto as well, and we're grateful to you for everybody involved for your leadership. I'll pass now to my colleague, Stephanie Pena. Over to you.
Great. Thank you, Jennifer. Thank you, everyone. These have been really, really informative presentations so far. And we are going to transition now to our last presentation. I'm really excited to introduce you all to Liesbeth Roolvink. She's the Deputy Technical Director of Inclusive Education at Sightsavers, and she'll be discussing a pilot study that Sightsavers has done using the child functioning module in Nigeria. So over to you, Liesbeth.
Thanks very much, Stephanie. Thanks for everyone who has presented and all the active engagement in the chat. I hope there is still headspace for another presentation. Some really good presentations so far. I hope I can connect some dots as well. And I'd like to take you back to Nigeria to talk a bit more about a pilot study that we have done in primary schools in Kaduna State. So moving away from Kano and Jigawa, but going to Kaduna State. And I'd like to share some of the findings of our work in Kaduna State. So if we can go to the next slide, please. Just very briefly, an overview of the project that we have initiated in Kaduna State. It's called the SMILE project, which stands for Support Mainstreaming Inclusion, so all learn equally. And it's funded by UK Aid under the DID Inclusive Futures program that is also co-facilitated by IDA. And the idea was to develop a community-driven approach to mainstreaming inclusive education so that children do not need to go to special schools far away, but can participate in their local village schools. And we have done that at a small scale, I have to say that. It's only in 8 schools in Kaduna State, in 1 LGA, in 1 local government area. But the intention was to just decide together with a number of stakeholders what could work in the context of Nigeria in a local school. So we wanted to keep it small scale so that we could really try innovative approaches with very close engagement of different stakeholders at different levels, so that we then identify things that work and don't work and can bring that to scale. So we started the project in January 2021 and it ends in September this year. But before we started this initiative, we had a 1-year design process, which was really to identify with key stakeholders, including OPDs, what are the barriers to inclusion and inclusive education in primary schools in Nigeria, and what can we as a project do? What do we want to take on to see if we can find some answers to the problems that have been identified. So if we can go to the next slide, I'd like to explain how we have done that. Basically, it was a very participatory approach to the design, but also to the implementation of the program. So we have established a steering committee, which is comprised of 15 key representatives of the government, both at the federal level, the state level, and the LGA level. And then they are together in the steering committee with 5 representatives of the OPDs. And they were selected in collaboration with IDA and ADF as part of a committee to oversee the selection of these partners. And basically, they have been involved in driving the identification of an approach to inclusion in Nigeria, but also they were very much put in the driver's seat during implementation. So I wanted to just share that, although that's not the focus of my presentation, but just as a context, because I agree with previous speakers about nothing about us without us. I think, you know, we have given OPDs a very important role to play, saying you are part of the decision making, both in the design phase as well as its implementation, but bringing them together with government representatives so that we can establish really close connections to understand each other's perspectives and to find effective ways to remove barriers for children with disabilities. So we promote a holistic approach to programming, and we try, you know, from a systems perspective to address different elements in the system that need to be more inclusive. So we focus on system strengthening. We have a strong capacity building component to it. It's very community driven. Parents and communities are strongly engaged. And there is an area of child participation that we really encourage and develop ways to make students more aware of what they can do from their perspective to create that enabling, inviting, disability inclusive environment at school. So for this specific presentation, I highlight one specific thing that we have tested in this program, and that is identification of children. So if we can go to the next slide. We used the child functioning module. And I'm not sure if everybody is familiar with that, but Maha also already pointed out that Education Cannot Wait uses the Washington Group short set of questions to identify children. This is a slightly different tool that is based on the Washington Group questions, but it's much more comprehensive. It's a questionnaire with 24 questions to basically look at what are functional difficulties that children may experience that might limit or influence participation in learning. So it's not a medical diagnosis, I have to make that very clear, but it's just to guide the school environment and the teachers in specific areas that may need attention, so that that will not hinder participation in learning. And these are in different domains, and I listed them on the slide: seeing, hearing, mobility, self-care, fine motor skills, communication, comprehension, learning, remembering, playing, controlling behavior, attention, concentrating, coping with change, relationships, and emotions. And the questionnaire is then looking into, are there any, in any of these areas, are there any issues with completing tasks or experiencing difficulties in these areas. Next slide, please. So why did we use the CFM? I think it's important to notice, and I think it was also already clear in the presentation from Zubaida, that there is a lot that still needs to be done in the area of disability inclusion, both in ECD as well as in primary and probably higher levels, but this project is specifically focused on primary. How do we identify children with disabilities? How do we know what their needs are? And I think there was a comment earlier in the chat from Kamal also pointing that out. It's like, how do the teachers know what the needs of the children are? I think this is a way this tool might help to identify specific areas that need some specific attention and some adaptations. But we were with the steering group together, and we were looking at the different tools that are available. There was no system in place at the moment in Nigeria in a systematic way to collect this data and to identify the needs of children. So we collected a number of tools available globally, regionally, and we discussed them, what would be suitable for the context of Nigeria, which tool did they feel would be most appropriate, so that we could pilot it and see if that was actually a helpful tool or that we need to look into other ways of addressing it. So it was a joint decision by the steering committee to choose CFM and pilot that in the 8 schools that we are currently working in. Next slide, please. So there is a clear process for administration of CFM. We decided to do it upon enrollment. When children come to school for the first time with their parents to enroll for the new school year, we trained the head teachers to then go through the questionnaire with the parents and with the child present to identify possible areas of difficulty. And going through this process obviously is also a good way to establish a connection with the child, the parent, and the school, the head teacher. And they were trained in doing this in a way that is totally confidential. Obviously, there is a number of steps.
Their own, if they're going to drill today, they've got all those things.
Sorry for the interruption. Please do keep your line on mute when you're not speaking. Thank you so much.
No worries. So yeah, so there is a clear protocol obviously lined out, and head teachers are trained to go through this protocol with the parents. And then at the end of the questionnaire, when the questionnaire is finished, the head teacher will talk to the parent about what this means, why we asked all these questions, and what that means in terms of facilitating the needs of the child. So if we go to the next slide, it explains what we have done with the parents, because obviously when you hear that your child may have some difficulties in certain areas, there might be some fear. It might be quite difficult to hear that from a stranger or some outsider or an authority figure. We wanted to ensure to the parents that we are in this together as a school, and as a system. We support your child. That's our intention. We want to make sure that your child can participate equally and can thrive in this village school. So there is a support network at the school level to work with the parent and the families and the community to make sure that the child can thrive in education. The guide that we provided to the parents also has a list of health service providers, because we feel obviously this is not a medical diagnosis, but in certain cases there is a serious need for follow-up for medical support. So we wanted to at least give the parents an opportunity to discuss with the head teacher, but also with our OPD partners, what can be done if there is follow-up needed, how to navigate that health system, because that can also be quite overwhelming. And so we tried to at least list some of the facilities and the services available for them in the area, as well as in the country if it was not available locally. So that was given to the parents to work with the parents. But then going to the results of the administration of the test, can we get the next slide, please? The key findings, and I go a bit fast because I know I have only limited time, but there's a lot to say, obviously, but I just give you a snapshot of the findings. But when we did the first round of CFM, we had 671 students assessed upon enrollment, and 166 were identified as children with a disability. That's 24.7%, which is quite high. I have to say that anxiety and depression came up very high, and that was part of the, obviously, of the scoring, and the questionnaire focuses on that quite a lot. In the context of Nigeria, and especially the LGA where we implement this program, there had been at that time quite a few incidences, security incidences, some kidnappings nearby. So obviously the communities and the children were affected by that, and that showed in the results. If we exclude anxiety and depression, the total number of children with disabilities is 12.2%. And that aligns more with the mixed survey that UNICEF conducted in 2021. That resulted in a 13% disability prevalence. And they also used the same tool, the CFM tool. So that was really interesting to see. There's obviously a lot to be said about the data. We're still analyzing that, but and we're having done another round after another enrollment period. So data is coming in through that, and we're looking at the findings of that to come up with a consolidated final findings. But these are the initial findings we wanted to share with you today. So if we go to the next slide, then I'd like to share with you a video that was made by one of the teachers in the participating schools, because I'd like you to hear from one of our teachers directly how he experienced working with the CFM tool and what that did to him and the community.
Our forefather, our parents, they have been looking down on children with disability. They think that that child doesn't have a hope, so they don't even want to enroll that child in the school.
They left them at home. They didn't even care to bring them to school. So I walk around house to house so that they should understand that by bringing them here, they will train them and get knowledge like other children. They can even also be the leaders of tomorrow.
So with this program, it has helped a lot. We have received a lot of training on how to teach children with disability. The child functional module has helped a lot because it has given me a guide on how I will handle children with disability. It was difficult at first. Those parents, they did not believe that what we are telling them is true. But as we begin to explain things to them, they begin to understand that those things that we are saying is real. From that place, some of them bring their children to enroll them into the learning. You have to let the parent know that it's confidential. You have to seek for their consent. From there, you ask questions, what are the challenges that the child is facing at home? Then you fill it down in that form. When you know the problem, then you know how to handle the child. Initially, their peers, they were looking down on them. So whenever they come close, they were bullied at those people. So with this program, we begin to create awareness, tell them that the same knowledge that they have, those children with disability, they equally have it. From them, they begin to accommodate them and they feel free and live with them. The education of the child with disability is very, very important, and they can contribute to the development of the country. My hope for these children with disability is someday I'll see one of them to become governor, chairman, and president of this country.
The Support Mainstreaming Inclusion So All Learn Equal, or SMILE project in Kaduna, Nigeria, aims to ensure that all children can participate in their local school. To find out more, contact Liesbeth Roolvink, LROOLVINK at Sightsavers.org, or Gillian McCullough.
So that brings me to the end of my session. There's obviously a lot more that I can say, and I'm very happy to answer any questions. Or I was checking in the chat, but yeah, maybe we can open it up for discussion. Jennifer?
Yes, thank you so much. Exactly. And I know there are quite a few materials that were used in the development of the child functioning module. But thank you to patients for asking if it's possible to have access to the child functioning module tool or anything that you would recommend. And then also just quickly, Lynn raised a great point asking all presenters, while the focus on inclusive education is critical, how do you coordinate and collaborate with national governments to improve the national education system broadly to respond to all children's learning needs? Evidence shows that focused efforts to improve learning environments for children with disabilities benefit all children and actors in schools. And we're grateful to Dr. Adama Ganyu and Dr. Hani for mentioning earlier, and Liesbeth, maybe this is the data that you kindly are previewing today. So if you want to share this as the final report becomes available, there was a question about the capacity building conducted. Have you been able to follow up with the trainees if the end users and beneficiaries have been reached and impacted, and to what extent? So it's an ongoing discussion. We're so grateful to all of you, and thanks for sharing the resources in the chat. Any quick reflections or things that you all think would be helpful in our last few minutes? Thanks.
think one of the reflections for me, Jennifer, looking into the systems perspective and working closely with the government, I think the experience that I just described in Nigeria with having a steering committee that is working with organizations of persons with disabilities as well as government representatives together and giving them some level of authority in decision making, that has been to me a very powerful way of working. Because first of all, in Sightsavers, we're just kind of facilitating that process rather than, you know, taking the lead. Because I think for me, the importance was to have engagement of OPDs, obviously, but bringing them together with the government and give them an assignment or a task together so that they have to speak together and establish those close connections to learn to understand each other's perspective and then moving forward together, making the decisions together. I think that is one of, for me, looking back at this program, probably one of the nicest outcomes or the most encouraging outcomes, that if we make those links and we establish those connections, that in going forward, when the project ends, these connections and relationships remain and the understanding of each other's perspective. So that going forward, and they talk about disability inclusion more widely in the sector, that they know where to find resource persons like OPDs to be part of the dialogue to make decisions.
That's a really great point. There's also a question kind of going back to the steering committee point, Liesbeth, where there's a question in the chat about what teacher involvement was. Were teacher educators and special education part of the steering committee or the stakeholders involved in that?
Yeah, very good question. Happy to hear that come up. Yes, they were part of it. There was someone from the National Teacher Institute as a member of the steering committee, which resulted in the development of a teacher training module for inclusive education, like a foundational training that we developed together with them again, so that it was completely owned by them. They produced the document in the end. We trained a number of faculty members of that institute so that they now use that also in other states where our program is not implementing anything. So it's again that commitment to system strengthening and building capacity within the system. And through our steering committee and the position that we gave to the representative of NTI, I think that really helped to also make them more committed to addressing disability inclusion and inclusive education in their training efforts to support professional development of teachers.
Absolutely. And I see another comment in the chat emphasizing the need to engage teachers in pre-service and in-service as well. There's a question quickly from Nafisa in the chat. How was the data collected and what plans are there to establish a referral pathway?
How was the data collected? Was that the question? Sorry.
Yeah, how was the data collected and what are the plans for, she's asking, was it paper or electronically?
It was paper-based. Yeah, it was paper-based. And the papers were stored, obviously, in terms of confidentiality. The schools received a cabinet that could be locked so that the data will be locked there, but accessible for school personnel, because especially after conducting the CFM and having that idea of where the functional difficulties may be, the next step obviously is to inform the receiving teacher so that the teacher is aware of these possible areas of difficulty so that they can adapt their teaching accordingly, which was then part of the teacher training to reflect on that and say, what kind of things can you do with the limited resources you have in your classroom to accommodate the needs of children that have just come into your classroom.
Great. And that last part of her question, is there any referral pathway part of this project in terms of like actually, because you mentioned very specifically, this is not a diagnosis, right? So is there any plans of that?
No, not in this project, unfortunately, and it's a very important issue that Nafisa brings up, and I'm glad that you did, Nafisa, because it's something again, we discussed with the steering committee and with the schools that we're working with, like how much can they take on, and we had to have that dialogue about balancing the responsibility as an educator and an education service provider, where does that end and where does health services come in, and what can we take on in education to facilitate medical follow-up. So what we felt was the best we could do within the limited time and resources we had in the project is to develop that service guide for parents, so that at least they know where to go for follow-up support. And they were guided by the OPD representatives, which we more or less connected to the families who had children with disabilities, so that they also had kind of a coach, mentor person that they could go to, who had lived through that experience, who knows the medical facilities better and the service providers in the area, so that they could go to someone to say, I don't know what to do, what should I do next? So that there is a network of support to ensure that the parents know where to go. But we had to draw a line somewhere, and that was what we could promise to deliver on, but taking them further to the actual medical diagnosis was something that was beyond the scope of the project.
Right. Great. Thank you so much. Thank you to all of our presenters today. This has been really great. The conversation has been great. The chat has been incredible. We will follow up with all of the presenters on some of the questions that weren't addressed during this time. And we'll circulate that around to everyone. We'll send this recording and the presentations and all of the additional incredible resources that you've all shared as well. We put some announcements into the chat. Our next coalition meeting, if you'd like to attend, please email the RSVP at gce-us.org. That will be on March 21st at 9 a.m. And some other information for some upcoming events. If you have any events that or webinars that you would like us to share with the community of practice, please send them to me and I'll share them with everyone in our community of practice as well. And if you have any suggestions for upcoming topics or presentations for the next Inclusive Education Early Childhood Community of Practice meeting, please reach out to me directly. I've put my email into the chat, spena@gce-us.org. And thank you all for joining. We will be in touch soon. Have a great rest of your week, everyone.